Let's bring in former Health and Human Services Secretary under President George W. Bush, former Wisconsin Governor Tommy Thompson. Mr. Secretary, what do you make of the roadblocks to this repeal and replace? Because, again, it looks like the Republican leadership in the Senate has bent over backwards to provide these centrist Republicans whatever they want. $45 billion in funding for opioid and heroin abuse. What, we're going to dial back. We're going to not basically roll back the tax increases in ObamaCare, and they're still not on board with even moving this to a debate. Why?
Well, I dig it. I think they are hearing from their governors. I'm hearing from their constituents. They're hearing from the American Medical Society saying that they don't like it. They're waiting for the CBO score that probably will show that a lot of people are not going to be covered by health insurance. So there's a lot of things piling up that's giving them solace to not commit, but also a lot of feed for thought to say maybe we got to wait and see what's going on. But the truth of the matter is Republicans have got to get their act together. America voted for Republicans for the House, the Senate, and the presidency, and that's what Republicans have been saying for years. Give us control and watch us get things done. They got to get things done, and the health care is number one. ObamaCare is failing, and people have got to realize it's not going back. Obamacare is not going to be able to be resurrected in its current form. It's too expensive, and it's got too many problems the insurance companies are not supporting. So Republicans have got to stand up, suck up their guts, and stand up and say, we promised, we got to get this done.
Governor, what is astounding, though, that because Republicans had so long to come up with a plan that was workable, that you would think that all of their members would sign on to. But you have like this, I mentioned it, and that's why I want to bring it up, this Ted Cruz amendment that's going to let insurers sell coverage that wouldn't meet the Obamacare standards as long as they sell some plans that did. And this is to essentially allow them to sell real bare bones plans to younger people. But you have the two major health insurance associations sent a letter to both the Republican and Democratic leadership, which is really unheard of, saying it's simply unworkable in any form and will undermine protections for those with pre-existing medical conditions, increase premiums, lead to widespread terminations of coverage for people currently enrolled in the individual market. Again, it seems what the Republicans are doing is so haphazard.
It doesn't look good, but anytime you try and put together a complex law like health care, there's no panacea. There's no perfect plan. So let's put that right on the table right up front. Obamacare is failing. The plan that's in front of the Senate right now is not perfect, but it's better than what the existing plan is. So the Republicans have got to get behind something soon, and this is the best thing out there. The perfect cannot be the defeat of the good. And that's what a lot of people are hoping for. And there's no perfect plan in health care. And I don't care. I've studied it all different ways. There's no perfect plan. But you got to move forward. And when Obamacare is failing, they got to put something in place. And Republicans are in charge. They got to get behind what is there and move it forward, get it ready for debate, and vote on it. That's their responsibility. That's what they told the voters of America, and they better stand up and do it.
Governor, do you see an issue happening here that given they didn't take back a lot of the taxes? I mean, they're taxing 3.8% on investment.
I don't like that.
So is
Governor, I don't either.
Any of us.
When you're a Republican and you're standing for Obama tax increases, and that's what's going on, you need to rethink your party affiliation.
So the question, oh yeah. So I was going to say. So the question remains: how can the Republicans push this plan through right now? With that, if they remove that, what? Basically, the question is: how can they remove that and still get this plan passed?
I don't like it. A lot of Republicans don't. I mean, they said they were going to get rid of the taxes, and now they're keeping the Obama taxes in place. That just doesn't make sense for a Republican to do that. But when you look at the evidence. First off, Obamacare is failing. America needs some kind of health care law. This is the best one. Is it perfect? No, I said that. It is not perfect. There's too much taxes, too much regulation, but it's better than the existing plan, and Republicans have got to get something done. They got to stand up and be counted, and if they're not, they're going to go down to defeat in 2018. They have no choice but to act. They said they were going to. Let's get on with it. Let's get the game going. Let's vote for at least getting it debated, and hopefully it can be fixed up going through the Senate, then the House, and then the Conference Committee. There are many ways to fix this bill, so let's hope they get started, and let's get moving.
So it seems to me that the American people elected Republicans to be in the House, the Senate, and the White House, so this would get done. And yet they can't seem to work in concert with each other, and gridlock seems to be worse than ever. Do you have any advice for them now on how to get over themselves and get something done?
Well, first off, you got to realize when the Democrats were in control in 2009, it took them a year and 3 months to pass their ObamaCare bill. So it's not unusual that a complex thing, which is not, and there's no perfect fix. If there was a perfect fix, we would have done it many years ago. There's no perfect fix. So what you got to do, the legislation, just like anything else, it's not very nice to watch. Like sausages and laws, it's best not to watch them being prepared. But the truth of the matter is, you got to get started. This is a start. It can be fixed up going through the legislative, congressional process, fixed up in the Senate, they go over to the House, there'll be further fixes, and also in the Conference Committee. And I think they got to start looking at too much taxes, too much regulation, but then they should also got to look at trying to get some Democrats to support it. Democrats should start coming to the forefront and say, you know, Obamacare is broken. We've got to do something. Let's join up with Republicans and get a bipartisan bill. That's what I did when I pushed through Part D, which is a very successful program. I got Democrats to support it, and we were able to get a bipartisan bill done. You never really change big social problems in America in a really equitable way without a bipartisan bill. And hopefully they're going to get some Democrats to start supporting it, and they will start working on this legislative journey and hopefully get going on it, because Republicans are right now are going to get hurt in the election in 2018 if they don't show up, get the work done as they promised.
Yep. Secretary Tommy Thompson, well said. Tommy, good to see you. Thank you for being here this morning.
Good seeing you. Thank you.
Always a pleasure.